So I'm going to demonstrate the setup for the sterile field for our wound comp. So I've removed all of my jewelry, my bracelets, and my rings. I've cleaned off the surface that I'm going to use. I have already put on my gown and my mask, but for this comp we're not going to require you to do that. So I'm already wearing my personal protective equipment. I do not need to have gloves on at this time point. So I'm going to take my sterile field and set it up first. So my package has already been opened, but what we're going to replicate is opening that package. We're going to grab the edges with our thumb and our thenar eminence, and we're going to pull apart and drop the sterile field onto our clean surface. Okay. The outside of this sterile field is clean. It's not going to be sterile, so we don't have any concerns about contaminating anything. So we're going to grab the outer edge of our sterile field, and we're actually going to shake it away from our table so that we can open up our sterile field, and then we're going to come over and place it. Sterile side is going to be up, the clean side is going to be down. Now with our sterile field, we always understand that the 1-inch border on the outside is going to be considered contaminated. So anytime we're dropping any equipment onto our sterile field, we want to avoid that 1-inch border. Now at this point, I'm going to grab my other equipment. So I have my gauze, and I don't want to open this over my sterile field because I could potentially contaminate it. So I'm going to again grab with my thenar eminence and my thumb and pull apart away from the table, and then I'm going to come back and dump my gauze in the middle of the sterile field. Okay. I also don't want to reach all the way across my sterile field because I could be contaminating the area as I'm reaching across. So this can now be deposited in the garbage. I have my tools in my blue package all ready to go on the sterile field as well. So again, with thumb and thenar eminence, I'm going to open this up and then put my tools onto my sterile field. If at any point you notice that you have made contact with some of your sterile tools or you think they may potentially be contaminated, if this occurs during the comp, please say that you were able to see that, and we'll ask you to kind of discuss what you would do in order to clean up your sterile field and set everything up again. Okay. What I'm also going to be doing is I have my container with my gauze in it for my wet to dry dressing. So with this, again, I'm going to stay away from my sterile field. I'm going to open up the lid, and I don't want to place this in my sterile field. I'm going to place it off to the side. The inside of the container is going to be considered sterile, whereas the outside is not necessarily sterile. And just put this off to the side. For my wet to dry dressing, I'm going to need saline solution to put into my gauze. I'm going to check the expiration date, make sure it's not expired. I'm also going to do some lipping to the edge of the saline so that I know that that is clean. For comp purposes, you do not have to take the top off. You can replicate how you're going to lip the edge of the bottle. What you would do is you're going to empty some of the saline and twist the bottle so that the saline runs over the edge where you're going to be pouring it. And then again, we're going to pour a little bit of saline solution into our gauze. The last few pieces of equipment that we're going to need are our grid so that we can measure our wound. And again, this is not sterile, this is just clean, so I'm going to put it off to the side outside of my sterile area. At this point, our sterile field is set up, so we need to put on our clean gloves so then we can go and assess the wound. So the reason I'm going to use clean gloves is because I'm going to take off my gauze and inspect the area around the wound and take my measurement. Anytime I'm going to do any treatment inside of the wound, I need to put on my sterile gloves and grab any sterile tools. Okay, so now I'm going to come over and inspect my wound. I'm wearing my clean gloves, and I'm going to pull off my imaginary gauze. So I would come in and remove the gauze. I would inspect the gauze to see what type of drainage or exudate and the amount, as well as the odor that was on the gauze itself. Still with my clean gloves on, I'm going to come in with my measurement scale, and I'm going to measure the widest and the longest part of the wound. Okay. So I can measure from one end over here. We can see that the wound is too wide for this scale. So I can rotate this and make the 0 point here, one end. And we can see that this wound is greater than 16 centimeters. So I can also come back later with my my tongue depressor or my cotton swab and measure it that way. The other length in the other direction here, we're going to say the max distance is about 7 or 8 centimeters. Okay. Also, inspecting the wound, we can see that it looks very red and pink. There's most likely a lot of exudate, and it is more likely a venous wound. We can observe a little bit of eschar in this part of the wound, so I'm most likely going to use some type of hydrocolloid over that particular segment, so I can cut a small piece and put that over there, and that would be selective debridement. Because of all the exudate, I'd most likely want to use some type of a high-density foam that I would pack this wound with. Okay. So now I want to inspect the wound bed, so I'm going to put on my sterile gloves. All right, so I'm going to demonstrate how to put on sterile gloves. So I've already opened this package, but because we're reusing equipment, I'm just going to talk you through it. So if you're going to grab the edges, make sure you use your thumb and your thenar eminence, and you're going to pull the package apart like this, okay? The outside of our glove package is not sterile, so we don't have to worry about touching the outside. Okay. We're going to lay it out, and there's these nice edges and cuffs that we can put our fingers underneath to open up our package. We want to go underneath these to pull the package apart because of exactly what just happened, okay? If we touch the inside part, if I were to touch this part and it were to fall back in, it would then contaminate my sterile gloves and they would no longer be sterile, okay? So that's why I'm gonna pull apart using the sides here of the package, okay? So I took off all of my rings, bracelets, everything so that I'm not going to puncture the gloves at all. So I'm gonna start by grabbing the outside of the cuff on one of my gloves, because this is going to be the inside of me, so I don't have to worry about it being sterile. Okay, so I can touch this part, and from here I can hang on to that cuff and put my glove on. Now if I get something twisted, that's fine. I can then come back later and touch and adjust using my sterile glove. Now that this hand is gloved and it's sterile, I'm going to go on the inside part of the cuff on the other glove, because this is the outside and this is sterile, and I'm going to use that to put on my other glove. And at this point I have sterile and sterile, so I can contact the outside of the glove to adjust it and put it on. Okay. Now if I had a gown on, I would want to make sure that the bottom part of my glove was over my gown. And if you notice, there was a little bit of folding at the very bottom of the gloves, so I would want to be concerned that that may potentially be contaminated. So I can either dispose of these and put on a new pair of sterile gloves, or I can assume that anything past the wrist is no longer sterile. And then I'm going to grab my sterile equipment. So if I grab my sterile Q-tip, okay, I can go in and I can palpate the wound bed to find the deepest part. So if I find the deepest part of the wound, right about here, there's a little depression, so I can measure using the side of my finger, and where my thumb is the depth of the wound. So then I can come over to my measurement scale and see that that is about 4 centimeters deep at the deepest point. And I would document that that is a little bit more to the right or the left side, depending on where the wound is on the patient. Okay. I'm also going to inspect the edges of the wound to look for any tunneling or undermining. Okay, I'm just going to hold this steady for our purposes so that it doesn't move on me. Okay, there's no apparent tunneling or undermining with this particular wound. Okay, I would say based on the depth of this wound, this is most likely a partial to full thickness wound, so this is most likely a stage 3 wound. So at this point, once I've inspected it, I've got my measurements, I've staged it, I've described it, I'm now going to apply my dressing. Okay, so I've already assessed my wound and I'm finished with my patient. So I'm going to come back to my sterile area, and now I have to clean up. Because my sterile gloves have been contaminated with biohazard type material, I don't want to clean up my area wearing these gloves. So I'm going to remove my sterile gloves. And the way that I do that is I'm going to pinch the outside of the gloves with one hand, and I'm going to reverse the glove into the other side, and then you can either use your pinky or another finger to come underneath the glove on the other side, and you're going to also turn this one inside out and pull them into each other so that all the biohazard material is contained on the inside, and then I'm going to throw these in the trash. Now at this point, I still need to clean up, so I'm going to put on clean gloves. You don't need to wash your hands in between because technically our hands are still clean with having gloves on before, and if you try to put a new pair of gloves on with wet hands, it's going to be a little challenging. So now that I have my clean gloves on now, what I'm going to do is, if I have any tools that need to be sterilized, I will need to put them in a special container to be sent off to the sterilization center. So in our comp, we're not going to actually have anything, so you're just going to talk through this. I have a little dish with a lid to use as an example for this. So let's say that this was my tool that needed to be sterilized. So what I'm going to do with this, I'm going to identify a clean hand and a dirty hand. So with my clean hand, I'm going to lift the lid of the area that I'm going to put my tool that needs to be cleaned. With my dirty hand, I'm going to pick up the tool and then deposit it in the container. So now with my dirty hand and my clean hand, I'm going to clean up my sterile area. So the dirty hand is going to pinch the top side of the sterile field and pull it in towards the middle. With my clean hand, I'm going to hold down the material. Again, dirty hand is going to grab the inside part of the sterile field, bring it towards the middle, and clean hand is going to stabilize the cloth. Top side of the sterile field with the dirty hand, clean hand is going to do that. The idea is that you want to try to bring all of the material towards the middle of the sterile area. You can think that you have sand on your sterile field, and you're trying to collect all of the sand into the middle. At this point, everything has balled up in towards the center, and then I can just take this and deposit it in the trash. Okay. At this point, I'm still wearing my gown and mask, so I can remove my gown, I can remove my clean gloves, okay, throw those away, I can go wash my hands, and then I can come and remove my mask.